All right, this is Dr. Anthony Chang, coming to you from Southern California during the COVID-19 pandemic, and I'm so happy to have good friend and colleague, Dr. Leo Celi, who is probably known to a lot of you. He's I would say he's the ultimate clinician data scientist because not only a senior clinician, he's still taking call in the ICU, and he's a well-known data scientist. So I'm a great admirer of his work and his passion. So Leo, how are things?
It's been surreal. I think that's an understatement. Since the pandemic started, we're all hands on deck. We very rapidly increased or expanded our ICU capacity. Before the pandemic, we were covering 3 ICUs with anywhere between 8 to 12 patients. And then at the height of the pandemic, I'm hoping it's the height of the pandemic, we were covering 8 units with anywhere between 8 to 12 patients. And all those patients have high acuity. So it's been crazy, to say the least.
Yeah, well, it's amazing that you're going through that and still working hard on your passion, which is sharing of data. So we really enjoyed reading your Lancet editorial and about sharing of data, and I think your passion comes through in the writing. Tell us how strongly you feel about this, and how do we move things forward?
What I have stated before is that our amulet to protect us for the second wave, the third wave, our best defense in terms of being able to end this pandemic is not going to be a cure or a vaccine. It's really our ability to learn from the data. That is our advantage over the virus. And as Yuval Harari said, the virus cannot compare notes. They cannot discuss how best to infect humans. But as humans, we can compare notes. We could learn how the virus spreads in the community. We could learn what are the complications so that we could prevent those complications. So really, I think that the thing to do is to combine our forces, look at all the data that we're amassing, and really identify best practices so that we will be able to tackle this pandemic the next time it shows up, or currently as it is still continuing to ravage the country.
Well, I really great admirer of Mimic. Used it during my student days for projects. But it has been 25 years since Mimic started, that whole project started, and yet in the interim, we've seen very few big publicly available databases. So what do you think is the biggest obstacle?
I think the biggest obstacle continues to be the culture, the attitudes around data, the politics, because we do have the technology. And I think Mimic and the other publicly available data sets are a testament that it is possible to do this. But we're still having a lot of pushback. There is still some resistance among the leadership in the academic community to share data and to get that data into the hands of as many investigators as possible. There are still silos between the domain experts and the machine learning experts. We're still finding it difficult to bring them together and really work together from the very start all the way to bringing those algorithms to the bedside. The problems that we're seeing before the pandemic continues. We are still facing a preponderance of journal publications, and only a minority of them, 1 or 2, are able to make it to the front lines, to the point of care. Yeah. So if we didn't have that pipeline of bringing these algorithms to the bedside, to the policymakers, it's going to be very challenging for us to be able to do that during this very stressful situation.
Yeah, no, I think you and I share that same passion about making machine learning and artificial intelligence very, very translatable to clinical medicine, especially in the front lines of venues like the ICU, surgery, and operating room. So I had the pleasure of joining you in Beijing, seems like about a long time ago now, to be part of your datathon. And tell us a little bit about your concept of the datathon.
So the datathon is really meant to address the biggest obstacle. It's creating that collaborative ecosystem. It's bringing together, interfacing the clinicians. These are not just the doctors, but the nurses, the pharmacists, who have all these ideas, who have all these questions, but they don't have the expertise to be able to dive into this very complicated, high resolution time series data that are being produced by electronic health records. And they have been so much fun, as you have experienced. But I think people don't see what's happening. It's not just meeting new friends and meeting new partners. It's really changing the way we're trying to perform research. It's changing the way we're trying to answer the questions that we meet on a day-to-day basis.
Right. Well, Leo, you are on the front lines, at the tip of the spear, and you're the doctor's hero for being that involved with really, really sick patients. So we hope to see you soon as you join us in future AMM meeting, and look forward to seeing you. And please keep safe and healthy. We're always thinking of you. So thank you, Leo.
Thank you, Anthony.